Hi everybody, this is Dr. Ravindran Kumaran from Apollo First Med Hospitals in Keel Park. I'm going to talk about the various emergencies somebody may experience with their gastrointestinal tract. So friends, often we hear about appendicitis as a reason why people go to emergencies in any hospitals, right? So appendix is an organ which is attached to the large intestine, can sometimes get infected. Depending upon the amount of infection, depending upon the background of the patient's health, different people present with different symptoms. Now, emergencies which are related to appendicitis are often because it is infected, and it happens in people who are in vulnerable age groups. So if you have a very young kid or if you have an elderly person, then they present in a very awkward fashion to the emergencies, often sick. But a lot of us who are in the middle age group will present with just pain in the lower abdomen, predominantly on the right side. So the typical history will be, I had generalized pain, and now the pain is more towards my right side. That is what you will hear. Usually acute appendicitis is a genuine acute symptom, right? You don't have pain for several weeks or days preceding it. So patients will have a short history. They will say, I was perfectly fine till point X, and from there on, within the last 24 hours, 48 hours, things have moved on. It can be associated with mild fever. Often patients refer to as feeling under the weather, like they've had a flu kind of symptoms, vaguely feeling unwell with pain in the right side, which can be progressive, worse with movements, walking, going upstairs, traveling in a two-wheeler will exacerbate the pain. You would require to go to a doctor, often to the emergency department. They will have to run some basic tests to look for what is happening, especially some kind of radiological investigation such as a CT or an ultrasound scan to pick up and confirm the diagnosis. Treatment for appendicitis is straightforward appendicectomy, often done laparoscopically in most institutions, and patients will recover very well as long as they have it done on time. So what happens if the patient kind of comes very late? The appendix can sometimes perforate, meaning it disintegrates because of the infection, and fecal material can contaminate the abdominal cavity, which is a big emergency, which often will push the patient to quite severe sepsis, requiring prolonged hospital admission, and the surgery itself can be very complicated. A word of caution about appendicitis. As I already said, elderly people, especially diabetic patients, can mask a lot of symptoms and present in a very moribund septic state, often requiring, being rushed to the hospital with an ambulance. So general word of caution, if you have pain, I think it is better to, especially persistent pain over several hours, it is better to have some medical consultation and make sure that we are along the right path of treatment. Thank you.